Basic surgical instruments. Different surgical procedures warrant the use of different surgical instruments. Knowing each instrument and its functions, as well as the basics in handling them, is the key to an easy flowing surgery. Scalpel blades. Blade holder. Blade number 11, also known as the stab knife, with its elongated triangular blade sharpened along the hypotenuse edge is with a strong pointed tip. Blade number 12, small, pointed, crescent-shaped blade sharpened along the inside edge of the curve, utilized as a suture cutter but also for arteriotomies, parotid surgeries, and uterolipotomies. Blade number 15, small curved cutting edge, and is most popular blade, ideal for making short and precise incisions. Blade number 10, used generally for making small incisions in skin and muscles. Blade number 20, a large version of blade number 10 with a curved cutting edge and an unsharpened back edge, used for orthopedic and general surgical procedures. In placing the blade into the blade holder, one should never use his bare hands to avoid unwanted injury. Instead, use the needle holder to pick up the blade and place it into the blade holder. In removing the blade from the holder, one should similarly use the needle holder. Needle holder must be held in a tripod or palming technique, and the needle must be placed 2/3 from the cutting point. Handling of surgical instruments. General guidelines. Ring instruments must utilize the ring and thumb as stabilizers of the instrument handle. Instruments must be held in prone position. The size of instruments must be proportionate to the tissue being handled. Needle, shaft, body, tip. Round needle, used for penetrating friable parenchymal and vascular tissues like the liver, spleen, and kidneys. Cutting needle, closure of superficial wounds and incision. Suture, absorbable sutures, breaks down over time and body, examples of which are catgut, polyglucaprone 25. Chromic O, for closing of the fascia layer in the abdominal surgery. Chromic 2O and 3O, skin closure when there is a lot of tension on the tissue, closure of muscle layers, or repair of bowel in surgery. Chromic 4O, skin closure. Non-absorbable suture, suture that needs to be removed, however, when used in the body, they will be retained inside the tissue, examples of which are silk and nylon. Silk 4O, commonly used in vascular graft sewing such as carotid endarterectomy. Scissors, iris scissors, used in cutting or fine dissection. Mayo scissors, cutting through tough fascia and cutting sutures. Metzenbaum scissors, used in dissection of delicate tissues like adhesiolysis. Pickup forceps, DeBakey forceps, for grasping deeper organs. Tissue forceps with teeth, for grasping skin and vascular tissues. Tissue forceps without teeth, for grasping visceral organs. Adson forceps, used for grasping soft tissue and used for suturing the skin. Clamp forceps, mosquito forceps, curved, for hemostasis, clamping bleeders. Straight, grasping fine tissues. Mosquito forceps have finer tips compared to Kelly forceps. Kelly forceps, curved, for grasping tissues and clamping larger vessels. Straight. Ovum forceps, sponge stick, ovum plus operating sponge, for blunt evacuation of blood clots such as in exploration. Mixture forceps, peanut pusher, mixture or Kelly plus operating sponge ball, for blunt dissection. Babcock forceps, for grasping hollow or visceral tissue. Alice forceps for grasping connective tissue. Vascular clamp forceps, used to clamp veins and arteries for vein and arterial repair. Intestinal clamp forceps, non-crushing, used to occlude the lumen at the anti-mesenteric border away from the blood supply. Towel clip forceps, to hold towels in place. Retractors, ring hook retractors, for retracting the delicate skin tissue commonly used in plastic surgery. Matthews or Sen retractor, for retracting superficial skin. Army-Navy retractor, for retracting superficial skin and subcutaneous tissues and abdominal wall. Richardson retractor, for retracting muscle tissue. Diva retractor, for retracting deeper tissues to expose organ of interest. Suction, Fraser tip suction, for small amount of suctioning needed, only one hole. Yankauer suction, general suction, 2 holes. Pool suction, general suction, many holes. Kidney basin, for specimen collection. Measuring glass, measuring and mixing substances. Round bowl, also used for specimen collection. Electrocautery pencil, monopolar. 2 modes. Cut. If the voltage is high enough, the heat generated can create a vapor pocket. The vapor pocket typically reaches temperatures of approximately 400 degrees Celsius, which vaporizes and explodes a small section of tissue, resulting in an incision. Coagulation. When the system is operating in coag mode, the voltage output is usually lower than in cut mode and less power is delivered. This therefore generates less heat and a vapor pocket is not generated. Tissue remains grossly intact, but cells are destroyed at the point of contact, and smaller vessels are destroyed and sealed, stopping capillary and small arterial bleeding.